What is an IUD? An IUD, intrauterine device, is put in the uterus to prevent pregnancy. It's a small piece of flexible plastic shaped like a T. There are two different kinds of IUDs, hormonal and non-hormonal. Hormonal IUDs, Mirena and Kylena, made of plastic, release a small amount of a synthetic hormone called progestin, which thickens your cervical mucus, blocking and trapping the sperm. The hormones also sometimes stop eggs from leaving your ovaries, called ovulation, which means there's no egg for a sperm to fertilize. May reduce cramps and may cause lighter periods, spotting, or no periods at all. Can last 5 to 8 years. Paragard, made of plastic and a small amount of copper. Sperm doesn't like copper, so the Paragard IUD makes it almost impossible for sperm to get to an egg. Can last up to 12 years. Why choose an IUD? Minimal effort. You don't have to remember to do anything for it to work, unlike the pill or the shot. Spontaneity. You don't need to do anything to prevent pregnancy prior to sex. Protecting yourself from STIs with a condom is always a good idea. Extremely effective. It is one of the closest birth controls to abstinence, over 99% effective. Low maintenance. Once inserted, the IUD stays in place for years without requiring any kind of maintenance or checkup. It's reversible. If you choose to get pregnant or want to switch methods, you can have the IUD taken out at any time. The contraceptive effects are gone as soon as the IUD is removed. Side effects. Spotting between periods, especially during the first few months after you get an IUD. Irregular periods. Cramps and backaches. Increased period flow and worse cramping for Paragard users. Insertion process. Your healthcare provider will first check your vagina, cervix, and uterus. They may test you for STIs. Your healthcare provider will then gently insert a speculum into your vagina to widen it. They will also clean your cervix and vagina with an antiseptic solution. Then they will use a special inserter to put the IUD through the opening of your cervix and into your uterus. What does getting an IUD inserted feel like? People usually feel some cramping or pain when they're getting their IUD placed. Insertion experiences range from painless to very painful, but most people say the procedure is less painful than they expected. Taking 800 milligrams of ibuprofen, not Tylenol or aspirin, 1 hour before insertion helps decrease any cramps. Some people feel dizzy during or right after the IUD is put in, and there's a small chance of fainting. What about after I get my IUD inserted? Many people feel perfectly fine right after they get an IUD, while others need to take it easy for a while. There could be some cramping and backaches. Heating pads and ibuprofen can help ease cramps. You may have cramping and spotting after getting an IUD, but this almost always goes away within 3 to 6 months. If you think an IUD is right for you, or you'd like to find out more, log into the Student Health Service portal and schedule an appointment.